Prime Minister Helen Clark, thank you so much for being here with us. The Washington Post last week had an article that said New Zealand is not only flattening the curve, but they're completely squashing it. I know that Prime Minister Ardern has said that you are one of her role models, and she has publicly sought advice from you over the course of the last couple of years. So I want to get your thoughts on why do you think that New Zealand has completely flattened and squashed the curve?
I think New Zealand is seeing relative success because it has leaders who are prepared to listen to the public health experts. When the more compelling information came out of Imperial College London about what such a strategy would do, New Zealand changed to an elimination strategy. We said we cannot tolerate what would be likely to happen to our older people, our vulnerable people, and indeed people randomly across age groups who are being struck down and killed by this disease.
Right.
So at that point, the Prime Minister came to the public. She said, we are taking all these new measures, a state of emergency was declared, and we went into a complete lockdown, actually more complete than you see in many countries. And we're 3 weeks into that today. Next week, the government will make a decision as to whether we continue at this very high level or start to adjust it down a little, depending on some parts of the country. The New Zealand public have been absolutely incredible. And I think that also speaks to a high level of trust and confidence in the political processes here. Also, political processes haven't been suspended. We have an oversight committee set up of our parliament, chaired by the leader of the opposition. It keeps going most days of the week. It's getting officials and academics and asking questions. So we have a free and transparent media, obviously. So all in all, we're on the right track. We're quietly optimistic about how we're handling this in New Zealand and getting a good result.
So I noticed that you mentioned a couple things about being on par globally. I'm interested to hear your thoughts about global solidarity and how you think we can achieve that, because as it is right now, in my personal opinion, there is no global solidarity.
You know, the World Health Organization was notified of this completely new virus on the 31st of December, and it spun wheels. It had guidance going up to countries from early January. The Director General of Health himself went to China to see the leaders to stress the importance of containing this. He convened the emergency committee under the public health regulations that they have. And by the end of the month, he had declared a public health emergency of international concern. And then they've just kept going, ratcheting up their advice and guidance. Now, it seems to me that really from late January, the rest of the world sat and watched the agony in Wuhan and other places in China and did very little to prepare for the pandemic reaching their shores. And what has been excruciating is to see the world's most powerful economies, G7 economies, almost every one of them struck down by this pandemic. Mm-hmm. What have we not learned since the 1917-18 influenza pandemic? This is far worse disease than that in many ways. So countries have not been responsible. Some took the approach that you could let it go through the community and build up a certain amount of immunity. Well, look at the cost of that in the United Kingdom right now, where these distressing stories of the virus being in some 2,000 rest homes for older people. And then they're not offering those older people, as far as I can see, anything much more than palliative care in many cases. And so when we reflect on the ethics of this, on the way it's been handled, on the exposure of the most vulnerable people in our society, our elderly, our frail, it is actually ethically and morally reprehensible. So now come to where we are now, still raging outbreaks in the global north, in the US. in Britain and in continental Europe. And I see Professor Lawrence Gostin of Washington, D.C., very well respected in global health circles, now saying that if we do not muster the solidarity to support the world's poorest countries to avert the scale of the pandemic as we have seen it, then those in the global north can expect up to 4 outbreaks re-emerging of this. So you'll think you're on top of it in New York, you'll think you're on top of it in London and Paris, but if you haven't helped Lesotho and Kenya and Ghana and wherever to deal with this, this is going to come back and infect the people that didn't get in the first 1, 2, 3 rounds in your own country. So I couldn't appeal more strongly for the international community to step up. And there is today another public letter from former Prime Minister Gordon Brown, who rallied the G20 at the time of the global financial crisis, and Larry Summers, former US Treasury Secretary, appealing for what amounts to almost a $2 trillion response put out through the international and regional financial institutions. So let's hope that some more solidarity can come out of those meetings this week.
I think you bring up a really, really important point about the lack of leadership here, because when you have poor leadership, it then becomes a choice of lives versus the economy and getting people back to work. And that is not a question, or that is not a decision.
That's a completely false choice. And it's a false choice that we hear some people, sadly, in leadership and in business making. They're saying we can't carry on with these lockdowns because it's destroying the economy. Actually, a bungled public health response is what has destroyed economies. And so if you have a lockdown and get some measure of success, but then take it off in an unthought out way, without having your testing systems in place, your contact tracing, your isolation, your quarantine, your geared up health system, you're going to be back where you were with the second, third, fourth waves of the disease. So this is just not a choice. People have to be planning now for the effects of this virus to linger around. And when I say linger, it could be a very explosive lingering for some time. We need that vaccine. The signs are promising that there will be one, but to roll it out on the scale required, even by the middle of next year, would be a Herculean endeavor.
Switching gears a little bit from global solidarity to city specific. As you know, I reside in New York City, and we have had some of the highest numbers in terms of tested positive cases as well as deaths. I know that you are familiar with our leadership, and specifically Governor Cuomo, as well as President Trump. What can you say to the leadership and how the US has handled the pandemic?
I've watched the situation unfold in New York, a city I lived in for 8 years and loved with horror. I have great admiration for the work that Governor Cuomo's been doing. And often, really with the President of the United States not being at all helpful to him. I've watched the daily utterances from the White House. I've seen what amount to the pained expressions of senior and very experienced public health and emergency management people standing beside and behind the President as he rants, really. And it's very distressing. The record will also show that he did not take advice in a timely manner, that there were serious voices in the administration urging action much more quickly. The president didn't want to hear that because he was tied up with this economy versus, what if a few people die kind of mentality. And so the US at the federal level came too late to the party, as it were. And now there's the risk of the federal administration trying to lift measures too soon. There was the extraordinary pronouncement by the president a couple of days ago that he could overrule what the states were doing, well, that's just been met with uproar, including from within his own party. So, look, this is one of, sadly, quite a number of failures of leadership that we have seen in response to this epidemic. Again, the history books will not be kind on those who did not move. And can I include among those the UN Security Council? I do think that the Secretary General should have used Article 99 of the Charter, and still could, to go to the Security Council and say, I regard this, and I'm putting this in front of you formally, as a matter that threatens global health and security, and I'm asking you to resolve the same. That has not been done. The Security Council has not taken the step, which it did in 2014 when it declared Ebola to be a threat to global health and security. And of course it was, but by and large it was contained to 3 countries, and then the world rallied around them and supported their recovery. Mm-hmm. Here we have a pandemic on an unprecedented scale with the combined health, economic and social effects, and the Security Council has yet to say anything substantive on the matter in a resolution. That too is a gross failure of leadership.
Yes, and I completely agree with you. I think that this just comes down to who is a great leader and how they're handling the situation. I think that will help the entire world to have global solidarity. Prime Minister Helen Clark, thank you so much for making the time to be here with us, especially during the pandemic, for sharing your thoughts on how we can both have global solidarity and flatten the curve. Thank you again, and I hope you stay safe.